Good to know. Okay, up next, blood pressure. That ever important measurement. Can you break down what this measurement tells us and why it's so important?
Blood pressure is all about the force of blood pushing against the walls of our arteries as our heart pumps. It's like measuring the pressure in a water pipe. You need enough pressure to keep the water flowing, but too much pressure can cause problems.
Right, like a burst pipe. Okay, that makes sense. But I always get those two numbers confused, the systolic and diastolic. Can you refresh my memory on what those mean?
Think of it this way. The systolic pressure, the top number, is like the peak pressure when your heart contracts and pushes the blood out.
Okay, so that's the high point.
Exactly. And the diastolic pressure, the bottom number, is the pressure when your heart relaxes between beats.
So it's like a heartbeat's rhythm, a peak and a valley.
Exactly. Systolic is the peak, diastolic is the valley. And of course, there are different ranges for blood pressure,
Yeah.
from normal to high.
Right. And how do we make sense of all those numbers?
We use the American Heart Association's blood pressure chart. It's like a roadmap for understanding those numbers and what they mean for your health. It categorizes blood pressure into different ranges, from normal to elevated to the various stages of hypertension.
Which is high blood pressure, right?
Right.
Now, taking blood pressure manually with a cuff and stethoscope, that always makes me nervous. Can you walk me through the steps? Maybe a quick refresher will help calm my nerves.
Sure, no problem. First, make sure the patient is comfortable and their arm is supported at heart level, legs uncrossed. We want them relaxed and ready for an accurate reading.
Wait, why do the legs need to be uncrossed?
Oh, crossed legs can actually elevate blood pressure slightly. We just want to eliminate any extra variables that could skew the results.
Ah, so we want a clean slate, so to speak.
Exactly. So legs uncrossed, arm at heart level.
Yeah.
What's next? Oh, right. You got to choose the right cuff size.
Yeah, those cuffs come in different sizes, don't they?
They do. And using the wrong size can give you inaccurate readings. It's super important to get this part right. Remember, too loose, false low.
Ooh, I like that. A handy mnemonic. So what happens after we have the right cuff size?
You'll place the cuff directly on their bare skin, about an inch above the elbow, making sure you can fit 2 fingers snugly underneath. You don't want it too tight, but it needs to be snug.
Okay, so placement is key. And where exactly are we aiming for with that cuff placement?
You want the arrow on the cuff to be lined up with the brachial artery. It runs down the inside of the arm,
Ah, okay.
and that's where you'll place the stethoscope to listen for those telltale sounds.
Okay, then comes the inflating part, right? How high do we pump up that cuff? I always feel like I'm going to make it explode.
Don't worry, those cuffs are pretty sturdy. You'll inflate it to about 30 millimilli Hg above the person's usual systolic pressure.
Okay, 30 above their normal systolic.
Right. Then you slowly release the pressure while listening carefully for the carrot cough sounds.
Karate cough sounds. Remind me, what are those again?
They're the distinct sounds of blood flow that you'll hear through the stethoscope. The first tapping sound you hear, that's the systolic pressure, the top number.
Ah, okay, so that's the first clue.
Yes. As you continue releasing the pressure, the sounds change. And eventually, the last clear sound you hear before it goes silent, that's the diastolic pressure, the bottom number.
So it's like listening for a change in the rhythm, from tapping to muffled to silent.
Exactly. And once you have those two numbers, you're good to go. Completely deflate the cuff, and you've got your blood pressure reading. With a little practice, it all becomes second nature.
Let's hope so. All right, next on our vital signs checklist is temperature, that classic measure of our internal heat. Why is this vital sign so important?
Temperature tells us a lot about our metabolic activity.
Metabolic activity.
Yeah, it's like the engine that keeps our bodies running. Our bodies are constantly working to maintain a stable internal temperature, even when the outside world is throwing us all sorts of curveballs.
So it's all about maintaining balance.
Exactly.
So what's considered a normal temperature range? And what happens when our temperature goes outside that range?
For most adults, a healthy temperature falls somewhere between 97.8 and 99 degrees Fahrenheit. But if our temperature drops too low, we're talking hypothermia, which can be really dangerous. And on the flip side, a high temperature, also known as hyperthermia, that can also be a sign of serious trouble.
So it's all about finding that sweet spot, that Goldilocks zone for our bodies.
Exactly.
Now, I know there are a bunch of different ways to measure temperature: oral, axillary, tympanic, temporal, even rectal. What are the pros and cons of each method? Why so many choices?
Well, each method has its own advantages and disadvantages. Oral temperatures are easy and convenient, but things like hot or cold drinks can throw off the reading. Axillary temperatures, the ones taken under the arm, they tend to be less accurate overall. Tympanic temperatures taken in the ear are super quick, but it can be tricky to get a good reading sometimes.
Oh, I've definitely struggled with those before. What about those temporal artery thermometers? They seem to be everywhere these days.
They're super user-friendly, but their accuracy can be affected by things like sweat or hair on the forehead. And then there's the rectal temperature measurement.
Okay, that one doesn't sound very fun.
It's not the most pleasant, that's for sure. But for infants, it's often the most accurate way to get a true reading.
So different methods for different situations.
Got it. Now, on to our final vital sign, pain. I was surprised to learn that this is considered a vital sign. How can something so subjective, so based on personal experience, be considered a vital sign along with all these other objective measurements?
That's a great question. Pain is considered a vital sign because it's a direct message from your body letting you know that something is wrong. And even though it's subjective, it's still an incredibly important piece of information.
So it's like the body's alarm system.
Exactly. And we need to pay attention to those alarms. It's crucial to believe patients when they say they're in pain. We can't just dismiss it because we can't physically see it or measure it with a fancy device.
Right, it's about trusting the patient's experience. So how do we go about assessing pain? Are there specific scales or tools we use?
For patients who are alert and oriented, we often use the 0 to 10 numeric rating scale. 0 means no pain, and 10 is the worst pain imaginable. Yeah, the classic rate your pain on a scale of 1 to 10. But what about patients who might have difficulty communicating, like young children? How do we assess their pain?
We often use the Wong-Baker Faces Scale. It has a series of faces that show different levels of pain. The patient can just point to the face that best matches how they're feeling.
Oh, that's a great idea. A picture is worth 1,000 words, right? So we've covered a lot of ground here. It's amazing how all of these measurements, from pulse and respiration to oxygen saturation, blood pressure, temperature, and even pain, can give us such a glimpse into the amazing workings of the human body.
And we've only just scratched the surface. These vital signs are more than just numbers on a chart. They're like puzzle pieces. And when you put them all together, you get a much clearer picture of what's going on.
I'm starting to see that bigger picture now. It's like each vital sign is a piece of a story. And when you combine them, you can really start to understand what the body is trying to tell you. So where do we go from here? What else can we learn about vital signs?
Well, in the next part of our deep dive, we'll explore how all these vital signs work together, like a well-coordinated team, to give us a more complete understanding of a person's health. We'll also look at how they play out in real-world scenarios.
Oh, that sounds fascinating. I can't wait.